Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? My father is an anesthetist. I remember his 1 in a million, way more rare actually, thing happen when I was like 13. He was knocking a patient out for the surgery, did the pre-op stuff. The woman's consultation earlier showed no flags for anything major. She had a reaction, which can happen, such as malignant hypothermia, but this wasn't that. Her reaction to the medication was where her own skin started to split and peel away from her body in large chunks. Her own body was rejecting her skin. The woman spent quite some time recovering. There was an investigation into the whole thing, but everything was done by the book and there was no reason for this to happen. The drug company was contacted and they had never heard or seen about this happening with any of the drugs. Drugs were taken and retested. This went on for a while. Turns out it was an allergic reaction to the drug and it's just the way it presented. It was so extremely rare no one had seen it with the drug that has been in use for decades all over the world. My father ended up writing a paper on it. Edit, we'll see if the paper is online or get the info on the journal it was published in. Was almost 20 years ago. This is a true moment straight out of House MD. It both illustrates how dumb luck can determine whether we live or die and how well trained and observant some professionals are. A neurologist I was rotating with once was walking to the parking lot through the emergency department and one of the docs stopped him and asked him to do a quick look-see on a lady he was about to discharge home. We called these drive-by consults. This woman had some vague, non-specific complaints like headache and passing dizziness but nothing out of the ordinary, and all tests in the came back negative, so she was waiting for discharge. Neurologist spends 5 minutes with her, comes back and says admit this woman and do a stat MRI of her brain. He noticed an extremely subtle vertical nystagmus of her eyes. A nystagmus is basically a repetitive, uncontrolled movement of your eyes which can have dozens of causes. A horizontal nystagmus is what you'll see 99.9% of the time and it's usually benign in origin. Vertical nystagmus, on the other hand, is a stroke in your cerebellum until proven otherwise. They sent the woman to MRI which showed infarctions in both sides of her cerebellum and she was in neurosurgery the next morning. If it weren't for that drive-by she would have been sent home and probably died overnight. Edit, I was not expecting this comment chain to get so large. A few people have pointed out that if she had surgery the next day and could have died overnight, why did she not pass away at the hospital? Answer is that non-surgical treatment also began as soon as she was admitted. One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mum's bloodstream. She had a cardiac arrest and we did CPR while doing an emergency C-section. She is slowly recovering but has lost most of her brain function. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? Had a very sick child with influenza. Spent 6 months in my ICU. Had a month of blood gases that were not compatible with life. Had multiple collapsed lungs. He's currently in 6th grade, no ventilator, no tracheostomy, literally no complications for the long term. This was years ago. Saw a teenager, 16 or 17, have a heart attack. Jacked athletic kid with 8-pack abs fell on the ground clutching his chest during basketball practice. Everyone in the pediatric thought it was a panic attack except for the adult resident who said, "I've seen hundreds of heart attacks. He's having a heart attack. Don't ask me why, but that's what this looks like." And that's what it was. He had an inborn anomaly where one of coronary arteries coursed between the pulmonary artery and the aorta. During exercise, the aorta and pulmonary artery expand with the increased cardiac output, and for whatever reason, that was the day that they squeezed a right coronary artery and caused a massive myocardial infarction. It was bad news bears. The damage was so bad, kid needed a heart transplant. He was transferred to a pediatric heart center. A left ventricular assist device (LVAD) was implanted because his heart function was so poor. A donor heart was found, and as he was being prepared for surgery, his own heart decided to suddenly start working again. It turns out that hearts can heal after a massive heart attack, especially teenage hearts in ripped, athletic kids with 8-pack abs. This was only discovered after the advent of the LVAD because prior to that, nobody would live long enough to recover. At the time, I think this kid was like one of the first 10 pediatric patients to get an LVAD at that hospital. So the kid had to get his coronary artery reimplanted so that it wasn't going to get squeezed like that again, but he got to keep his heart, and I hear he recovered and returned to playing basketball. Edit, a typo. I spayed and neutered a hermaphrodite pit bull once. I once saw a newborn baby who was a true hermaphrodite, intersex person. I was part of the meeting with the top pediatricians discussing the case. The patient's gender was clinically indeterminate from external genitalia. MRI showed one ovary and half a uterus on one side and a partially descended testicle on the other side. To decide once and for all, they used genetic analysis to analyze the chromosal makeup. However, this showed a 50-50 mosaic of cells, some of which were XX female and some of which were XY male. A very confusing case as to what to do next. Unfortunately, I was unable to follow this one up. I once saw an IV drug user who managed to break an old needle off in his vein when injecting and presented with chest pain. It was only when we were doing an angiogram we noticed the needle fragment embedded in his heart. I've never seen this before or since. Too long, didn't read, needle inside the heart in a drug user, couldn't get it out. Bad situation. I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure, and no detectable pulse. I couldn't even hear his heartbeat with a high-quality stethoscope. They dumped a few bags of fluid in him in the ED before they were barely able to get a BP on him. Story from last year. After a pretty uneventful pregnancy, a woman goes into labor but it doesn't advance as quickly as it should, so she gets a secondary cesarean section, standard procedure. The baby gets out and its eyeball is almost pressed out of the eye socket. Everybody is in shock, the parents start crying, we don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there, so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million, it's actually 0.3 per million, so I hope I'll never see such a case again. Edit, unfortunately I don't know the outcome, the child was transferred to another hospital. My aunt and uncle-in-law are both doctors. Once, she was lying on his stomach and she heard something odd in his pulse, blood flow. Went to the hospital that night and he had surgery to resolve an blockage which if it had ruptured he would have been dead in 10 minutes. All by pure chance. I would say I have seen 2 cases of this. The first one was a dude who got stabbed in the chest. He arrived at the ER and had the knife moving with his heartbeat, but he was actually stable, in pain but stable. We got him to the OR, and to my surprise the knife went into the heart, but was about 1 mm from going into the inner cavities, so he was saved by 1 mm from probably dying. X-ray. The second one was a young man who got shot in the back. He came in the ER with pain but very stable. He went to a CT scan, and the image was just incredible. It's not simple to explain without an image or if you're not used to seeing CT scans, but the bullet went in through his back. Missed the right kidney, liver, the spine, and ended between his aorta and cava. It was just the perfect trajectory to miss everything. 1 mm in every direction could have been fatal. I couldn't believe that shit, haha. This is a random image I found, and in red is the trajectory the bullet had. Edit, looking for some of the photos. That hospital gave me some weird shit, haha. This is another case, but very rare to see. NSFW, since PPL are asking. This man was run over by a truck in the highway. He died due to severe injuries, one of them the one you see on the picture. Got the X-ray for the first one and one to explain the second. Not a doctor. My friend was internally decapitated when he was 47. Today I talked with him, his voice is different, and he told me he's started playing hockey again. I don't know the odds of surviving this accident. But what I do know is, who survives this accident and goes and plays hockey just 18 months later? Thanks for watching. What would be your response? Leave it in the comments and see what the others say. Please also like and subscribe if you enjoyed the video. Until next time, take care.